And we continue with men's health and the real stories of men's health. We have received a number of questions on our website, www.drridwan.com. Please submit questions on our website for our future shows. Well, in men's health, we received a number of questions. For example, John from Houston, Texas asked, I am a 57-year-old man with frequent fatigue. In the afternoon, I frequently feel very tired, something that is new, has not happened in the past, only in the past 1 or 2 years. So I would like to ask Dr. Sadowski, what are the potential causes of frequent fatigue in such a middle-aged man, and what should he do?
Well, fatigue is a very common problem among American men and women, and it's kind of perplexing for those of us in medical practice to try and figure it out. What the man with fatigue should certainly do is come to his healthcare professional and try and find out what the problem is. There are lots of medical problems that cause fatigue. This particular man may be anemic, he may have some kind of chronic medical problem, he may have a chronic inflammation or an infection going on that he doesn't know, or some other disease. So it's very important to get a medical examination. We're also starting to learn that sexual hormones also can cause fatigue. In men, a decline in testosterone can be responsible for causing a man to sort of lose his energy and lose his vitality. So although there is a slow decline in the testosterone levels in men as they age, if it declines too rapidly, that can cause fatigue.
Just to add on to that, I think one of the things that a man can do also, before he goes to the doctor, is ask himself some questions. When did this start? It's a recent onset. What's he doing when this happens? Is he bored? Is he depressed? Has an alteration in either his exercise level, change in nutrition? These are all things that would be of interest to his physician. But the most important thing is to recognize you have a problem and not get into this macho thing of kind of presuming it's going to go away. Go to the doctor, check it out, and be reassured and allow yourself to do so. It's exactly what women do, which is part of why women are frequently more healthy than men.
Thank you very much. And we go to our next question, which came from Terry in Wayne, New Jersey. He is a 57-year-old man with heart disease, high blood pressure, lower back pain, and too busy at work. He is asking, where should he start?
It sounds like he started right if he decides to go to his doctor and start talking a little bit about some of these medical problems. The cardiovascular disease and hypertension could be serious, and lower back pain could be a more serious symptom than he thinks. What we try and do as a good doctor is look at what we think is important to evaluate in the patient, but also take into account what the patient thinks is important. So I think where he should start is tell a doctor all of his symptoms, be honest, tell what's important to him, listen to the doctor, and then get a full evaluation.
Thank you. And here's another question that was submitted on our website and another real story about men's health, but this time it comes from a woman, the woman in that man's life. Fatima from Beirut submitted a question. She said, my husband, he's a 61-year-old man, snores heavily and refuses to go to the doctor. What should she do? What should he do? Dr. Sadowski.
Well, hopefully she's going to try and get him to come and see a doctor, because snoring at night can be a symptom of several different kinds of medical and or sexual issues. So the first job she really has is to convince him that snoring is important and it's bothering her, not only keeping her awake, but it may be a sign of a medical problem for him.
Dr. Sadowski, isn't it also highly associated with obesity in a number of men as well? Is that something that you would look for as a physician in a situation?
Snoring at night can certainly be a sign of sleep apnea, or it could be a sign of just congested sinuses. So if the man is obese, it's more likely to be sleep apnea. Sleep apnea is a medical problem where the upper part of the trachea gets blocked while the man is sleeping, and the man snores to try and open the airway up, and then actually wakes up suddenly. Men who have sleep apnea often fall asleep during the day. But I think the important thing with this snoring man is to evaluate him, number one, for this problem that I mentioned of sleep apnea, and number two, to evaluate him for sexual problems in testosterone, because we know that aberrations or changes in testosterone, abnormalities in testosterone, can cause snoring.
Here's another question. Patricia from New York said, I go to the gym and exercise 4 times a week. My husband seldom goes to the gym and seldom exercises. How much exercise should he do? And what can I do to motivate him? Dr. Perlman.
It's funny, these are actually 3 questions in one. And the first is your comment, which reminds me of how frequently it is that women make the appointments for men, and it's women who help us get to the doctor. Now, she's doing some really good stuff for herself by exercising like that. But the issue of how to get him to go, I would say start with just getting him to take a walk with you. Start with trying to get him to be more active. And if he's unwilling to do so, express your concern both for his health and based on everything that's been said so far, we can fairly safely predict that there's going to be some negative consequences to his lack of exercise, which I suspect he's aware of and may not want to address. So finding out, having a conversation about why he doesn't want to go with, what are some fun activities that he could be doing that would get him to be more active, and rather than insisting he do one particular thing, try and get him to do something that he'd like to do and just join in to help make it happen. Take it one step at a time, literally in this case.
Thank you for answering these questions, and many thanks to you for submitting questions on our website, www.drridwan.com. Thank you again, and stay with us. This is the Dr. Ridwan Show, health information you can use.